You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is Caleb Granger. He's the founder and president of Apex Medical. We're going to talk about what's called either extracellular vesicles or exosomes, and why 99% of stem cells that are taken out of people die within 24 hours, obviously rendering them useless. So I would guess that, we'll get into it, but Apex has probably found ways to make sure that survivability is much longer and that these amazing tools can be put to good use. So welcome, Caleb.
Thank you so much, Richard. Glad to be here.
Yeah. Well, tell me a bit about Apex. What's the goal of the company and the focus?
Sure. So Apex Regenerative is a regenerative medicine company. We do essentially go after that regenerative component with two pillars. One is increasing your cellular power. And so we do that through the only intracellular NAD. NAD is the single molecule that powers all of your body's cells. So we have an oral supplement that has been shown in human studies to raise intracellular NAD, which is something that's unique among NAD supplementation currently, can raise your intracellular NAD 53% on average in 5 days, 300% or more in 60 days. And so we can reproducibly raise your total kind of cellular health. And then we also do produce placental and umbilical derived live tissue mesenchymal stem cell exosomes. Exosomes are the information carrying microparticles that stem cells, actually all cells, secrete. And so exosomes are kind of the language of cellular information transfer. And we take the most potent healing generative cells that the body ever produces, get the exosomes from those cells and deliver them in a therapeutic way in a variety of modalities to help essentially anybody that has a degenerative or inflammatory condition. What we're finding and what the peer-reviewed studies are finding, massive amount of peer-reviewed studies. So power up the cells and then use exosomes to show those cells where and how to heal.
So what are the most common conditions people will come to you for help?
It's fascinating. The exosome literature and everything is being done clinically on exosomes. It doesn't negate what we know and the literature on stem cells. In fact, it builds on that. They are stem cell exosomes. Therapeutic stem cell exosomes is what we use. And so what we now know after 20, 25 years of doing stem cells therapeutically, we now know that the way stem cells work when they're doing their healing is through paracrine signaling and these exosomes that they secrete. That's how they work. So we kind of take out the middleman and leave the stem cells, which are inflammatory. They are capable of carrying genetic, viral, and bacterial load, and just take their signals that have all the proteins, growth factors, and regenerative signals and no cells. So we cut out the middleman, are able to deliver in a systemic way via IV, sublingual spray, or intranasal spray, via direct injection, intraarticular or intratendinous, and sublingual, I mentioned that, topical, subcutaneous injections are incredible for aesthetic treatments and that sort of thing. Your question is, who would use it? Well, anyone that has any degenerative or inflammatory condition. And so that's, of course, a wide swath. We see incredible application. We've now treated about 13,000 patients in the last 3 years. We started with the first year, we did about 500 patients, all in the US. The next year, about 2,500 patients. And this last year, about 10,000. And we're have a trend to do about twice that this year in 2026. The majority of those patients at the beginning were mainly orthopedic. So they were degenerative and inflammatory orthopedic indications. So, the typical arthritic bone-on-bone knee or hip or ankle or toe joint or wrist or elbow or shoulder, all of those at the beginning, we were treating those primarily with acute intraarticular or intratendinous injections. What we found was, and those did incredible, there's an immediate anti-inflammatory response, and then the entire body is filled with healing signals. And so that creates this healing cascade. What we've found now is, and what the studies show, is that you get the best result when you are carrying out kind of systemic protocols. So if instead of just doing one injection, if we do an injection, we also do an IV that same day. And studies are shown even from doing that, injection and IV the same day, that within 3 months, and then definitely by 6 months in arthritic hips, bone on bone, hips and knees, that there's a study that showed 1.2 millimeters, essentially on average, new cartilage growth in osteoarthritic bone on bone knees, and little more than 1.3 millimeters new cartilage growth in bone on bone hips.
Well, with how many treatments?
With one treatment. So it's a one systemic treatment, right? So it's the injection plus IV. What we do typically now as our standard protocol is we'll do that. If you need an injection, we'll do an injection. That's usually if you have pain 7, 8, or 9 out of 10 constantly. If you have less than that, if it's significant pain, but it can spike up to 7 or 9, and normally it's 3, 4, or 5 out of 10, we see incredible results with just a systemic protocol. So typically a 60 or 90-day protocol where we can do a bolus of exosomes via an IV or multiple IVs, and then a daily sublingual that keeps kind of a steady state amount of healing signals going through your body. We can provide about 10 billion exosomes per day through your sublingual glands. And that combination has incredible healing and symptom reversal properties, and can actually regrow the internal components of the joint. And we've used it in up to 103-year-old. That wasn't for joint stuff. That was for kind of degenerative and inflammatory brain-based conditions and that sort of thing. But what we're finding is that, kind of the way to look at aging, for instance, and all the degeneration that we associate with aging, is that aging is the moment when your growth degeneration outstripped your internal regenerative capacity, right? So there's a point where your growth regenerative capacity is higher than the degeneration that your body faces, either self-inflicted, environmental, genetic, right? When you're a kid and you fall and break your arm, well, your regenerative capacity is such that even though you've inflicted this level of degeneration, traumatic degeneration, you will heal that bone and it will heal back stronger and, with greater tensile strength, right? And there's so many other examples of that when you're a kid. That's because your regenerative capacity is higher than the gross degeneration your body faces. At some point, those two become offset and your regenerative capacity can no longer keep up with degeneration. When that happens, you're now aging, right? And that accelerates over time. We can reproducibly, consistently with our protocols, raise your body's gross regenerative capacity until it once again outstrips your degeneration. And so that is the definition of anti-aging. We do that with protocols, 60 and 90-day protocols that really magnify your regenerative capacity. And when we do that, we see incredible regenerative results with orthopedic applications, but not just that, brain-based degenerative conditions.
What happens if I have let's say I have a knee problem? You would do injections, or would you do, an IV to help my knee? Once that's fixed, I would think there'd be a spillover, or even with the initial injection and or infusion, there'd be a spillover and it would go to the rest of my body. I guess the exosomes just look for the next damaged tissue and then they fix that and fix the next and fix the next. Is there any point or need in controlling the cascade as it goes through the body? Can it be much?
It really can't. So there's been studies that have been done where, for instance, they tried to give a toxic amount in an athymic rat model. Athymic rat is kind of established by the FDA. These are the closest. They're used for pharmacological applications. They're used for device applications. They're kind of the closest genetically to humans is this athymic rat. In an athymic rat model that was a healing model, it was showing concentrations, right? They did a 500 million, 1 billion, and 2 billion exosome concentration in a bone break model on athymic rats, and then watched how the rats healed. What it found was essentially as you doubled the concentration, you essentially doubled the healing, the speed and fullness of the healing. In that same study, they gave what they thought would be 6 times a toxic dose of exosomes to these rats based on their, blood volume and that sort of thing. So it'd be like, you and I drinking a gallon of exosomes. It essentially made these rats super rats. There wasn't a toxic amount. It makes sense because the source material from whence we get these exosomes is the placental and umbilical material. There's a long established history of safe use of placental material in surgery, in brain surgery, in oncological brain surgery, where we take take my background is neurosurgery, orthopedic surgery, and spine surgery for the last 26 years. And then in the last 3 years have started Apex Regenerative. And so focused on the regenerative side. In neurosurgery, spine surgery, and orthopedic surgery, for 25 years, we've used dehydrated placental material, dehydrated placental lining as what's called a dural repair. The dura is kind of a thin wetsuit material that covers the wetsuit-like material that covers the brain and spinal cord. You get like an intradural injection, right? That's going into the spinal cord. This is used, it's been FDA cleared, so meaning it's been safe and efficacious. It works and it's safe in humans, the placental material as a dural repair, right? To be laid over the brain. If you do brain surgery, they say, lay this stuff over the brain. It's safe and works to heal that covering. In those applications, we know the only thing better than 2 pieces of placental material is 4 pieces of placental material, right? They're angiogenic, blood vessel forming. They're anti-inflammatory. They're antibacterial. There's studies that have shown that they use it in oncological settings in the brain. They use it in breast surgery, where they take out a tumor and then line the margin with placental material.
I was going to ask you, right? If someone has cancer that's, in metastasis,
sure,
this doesn't push that along. Will it slow it or stop it? Or has there been any error with that?
Yeah, there's actually been, so there has never been a study showing that therapeutic mesenchymal stem cell exosomes initiate cancer, accelerate cancer. So that hasn't been shown. Again, given what we know about how they're used in an oncological setting, how the placental material itself is used, right? And that's just the placental material. That's not a cell-free, super clean, just healing properties thing like exosomes is. Even that, just the material, the tissue has cancer-fighting properties. So one of the things that happens, Richard, is that people, for instance, if you Google exosomes, one of the AI prompts from Google's AI says the dark side of exosomes. You go to that, the dark side of exosomes, it talks about cancer cell exosomes. Well, the reason that comes up is because every cell secretes exosomes. That's how cells talk to each other. That's how they pass on information, is through exosomes. So cancer cells have cancer cell exosomes. So the dark side is that cancer cells have exosomes. That's not what we're using. We're using 0-day-old placental and umbilical live tissue-derived mesenchymal stem cell exosomes. The exosome only carries whatever their source cell produces, right? And so the cells that we use, mesenchymal stem cells from placental material, have spent the last 9 months processing everything that was needed to create an entire perfect human being from 2 cells, right? That's been their task for the last 9 months. The day they finish doing that, we get them elicit the exosomes and all the generative power to generate perfectly everything in the body, hair, lungs, brain, muscle, heart, everything. They bear that generative potential in their exosomes. And so we then get hundreds of billions of them and deliver them to the body, whether it's acutely in the joint or systemically. People get an incredible benefit. We see an incredible benefit with anything degenerative or inflammatory when they're taken systemically. And so, you think about what all that can be, all the dementias, right? Alzheimer's, vascular dementia, post-stroke recovery, traumatic brain injury. We've got about 30 NFL and NBA guys that are doing these protocols, these daily protocols. And a lot of the NFL guys are either, towards the end of their career, and a lot of them have these CTE symptoms, which are TBI, traumatic brain injury type symptoms, and get incredible resolution of those symptoms with this because it takes away inflammation and starts regenerating where there's calcified tissue or tissue that's not having proper vascular flow. It's blood vessel forming. It's angiogenic. It's nerve regenerating. It's tissue regenerating of all kinds. And so when you can flood the entire body with increased regenerative capability, your body now just heals these things that it had no capability of healing because its regenerative capacity was not high enough to overcome the degeneration.
Yeah, that's amazing.
It really is.
So is this now like people can, you have clinics where people can visit, just get a shot and go, or is it an inpatient type thing?
Yeah, so we're the manufacturer. We work with providers throughout the U.S. We're based out of Austin. And so we have, of course, very close, relationships with providers here in the Austin area. So
you're in Austin? Oh, son, I'm coming over.
Awesome. Yeah. So in Austin, for instance, we can do, we've got multiple nurses. We can do kind of concierge white glove service at your home or office for our IVs. That's the primary foundational thing, is our placental derived IVs. That's the most potent and most healing version that's available. And we have the most potent and healing version commercially available in the US. We do those IVs. We can do a direct to you sublingual or intranasal. The sublingual is just a daily spray, 5 sprays under the tongue that gets 10 billion exosomes into your bloodstream through your sublingual glands. Intranasal is for any skull-based or brain-based condition. Incredible, even for like depression and ADHD and autism, certainly for Alzheimer's and Parkinson's. We see incredible results, and there's incredible peer-reviewed published studies that are in the literature. That's another thing that I want to mention is this is something that's relatively new. Let's call it in the last 7 or 8 years, that we now know that unlike what was previously thought for the last 20 years, that stem cells don't get into your body, stay alive, engraft in the body, duplicate, and eventually differentiate into various tissues. That was the thought of what stem cells did for the last 15 years. For the last 7 or 8 years, in fact, the father of stem cells, a guy named Dr. Arnold Kaplan, who coined the phrase mesenchymal stem cells, discovered that and coined the phrase. He published a study in 2018 saying, from what we now know about how mesenchymal stem cells work, they should be called medicinal signaling cells. MSC should stand for not mesenchymal stem cells, but medicinal signaling cells, because they're essentially exosome carriers. We now know that if you get a stem cell injection or infusion, those stem cells, 99% of them are flushed or killed by your body. Your body sees them as a foreign invader, even if they're your own cells. And they're flushed and killed within 24 hours, all of them for sure within 72 hours. The benefit you would get from a 24 to 72 hour infusion of stem cells is only in the fact that they are carrying and secreting exosomes. We now know that's how they work, is by secreting these exosomes. So, that is totally established, and it's relatively new information. From 1965 to 2019, there's approximately 0 studies on stem cell exosomes as a therapy. From 2020 to today, there's close to 43,000 peer-reviewed published studies on stem cell exosomes as a therapy. It is You think about any other surgical intervention, drug, insulin, aspirin, anything. There is nothing that has that level of peer-reviewed published studies in such a short period of time that has that many at all. And certainly that has that many within 5 years of kind of being discovered. So, and all of it is basically the pinnacle of it all, peaks off of and is built off of the tens of thousands of studies on stem cells as a therapy. Because what we now know is anything good that the stem cells did, they did by secreting exosomes.
How do you culture enough of them? And I would think they're incredibly fragile because they're so small. Like if you have to centrifuge them, they would tear to pieces. Like I know it's probably proprietary, but how have people figured out how to keep them from, keep them usable?
Yeah, it's really this ultra centrifugation, right? That you're starting to describe. That's really what it is. They are actually robust. And so cells are not robust. Cells really have to be treated with kid gloves. And kind of the more specialized the cell, the more you have to treat them with kid gloves throughout the entire process, including the delivery. Cells you have to be worried about. You can actually crush cells by putting them through a cannula that's too small. That's not the case with exosomes. Exosomes are 1/1000th the size of a cell. They are, because of that, they're able to, unlike cells, cross the blood-brain barrier, and so can perfuse into the brain and take away inflammation in the brain, regenerate tissue in the brain. When you do intranasal application, there's studies that show within 1 hour, 90% of the exosomes are in the midbrain and hippocampus, taking away inflammation and regenerating brain tissue. In Alzheimer's models, they show that the exosomes target and dissolve beta amyloid plaque and regenerate the brain tissue that the plaque ate away. And so
that's amazing.
It's amazing.
Quick question here. They sound like they're similar order of size of viruses. Has anyone attempted to inject them or inhale them when, let's say, they have the flu? Does it work? I don't know. Is that an application that's been tested yet?
Oh my gosh! One of the most tested applications is is for the treatment of long COVID. And so that's a fascinating thing. That was, in the early 2020s, of course, that this started. And so now there's multiple years of data. The symptom list for long COVID is identical to the symptom list for a vaccine injury, which is fascinating. Vaccine injury isn't studied. Long COVID is, but, depending on kind of where you land on that, know that it is applicable to both of those things. The symptom list for long COVID is a 60 disease list, 60. It's essentially the 60 most popular inflammatory and degenerative conditions that Americans face. Type 1 and type 2 diabetes, Alzheimer's, Parkinson's, depression, neuropathy, it's a massive list. And that is the long COVID list. The original study that was done was with 600 people given 6 IVs where they were hospitalized for COVID. 300 got saline IVs, 300 got exosome IVs, and 2 years later, 88% of the no exosome group had one or more of those diseases. 20% of the exosome group had one or more of those diseases at 2 years later, right? So massive, statistically significant healing and prophylactic effect against the top 60 diseases that plague Americans. We integrate that into our protocols because basically that's 600 billion, 100 billion per IV. We know that is going to help. We know that is going to make you statistically significantly healthier. And we also know from our protocols and what was originally a type 2 diabetic patient cohort, is that from one IV and 6 days of sublingual, which is essentially week 1 of our 60 or 90 day protocols, from 1 week of our protocol, that we see a 500 to 1,000% reduction in total body inflammation as measured through ESR. So you imagine that, inflammation is just so pervasive, right? Everybody has a low grade level, at least, of total body inflammation. Inflammation is the body's signal to send healing. Well, if the entire body is inflamed, clearly your healing capacity is totally overwhelmed. And so as a result, a thing that actually needs healing can't get healing because your body's trying to heal everything, right? When we can reproducibly lower your total body inflammation 500 to 1,000%, you mentioned it at the beginning of the show that we would do something for an orthopedic injury, right? Say a right knee that was degenerated, get symptom cessation of that right knee, but also the left knee would feel better. Also, the arthritic swelling in the second knuckle on both hands would totally go away. Their psoriasis would go away. 3 years of psoriasis, their eczema would go away. Their sinuses would clear up. Their eyesight would improve. It's all the things that, again, ultimately, when you raise your regenerative capacity, and it can now go back to outstripping the amount of degeneration your body faces, that's anti-aging. And so that's what we end up getting. And of course, it varies by patient, but we can reproducibly, with our protocols, just bring your body's regenerative capacity up significantly. And when we do that, you really see an incredible result that shows itself in all the biological markers as well. A1C, AST, ALT, right? All the things that get higher as you age and are in worse shape, we can have, single and double digit percentage reductions in 60 and 90 days.
Yeah, that's amazing.
Every day I say we're close to 13,000 patients. And so, I personally hear about this, right, from a lot of our providers, and man, just got a note from somebody recently who was doing our protocol and was doing it for her cystic acne, right? And 30 years of cystic acne, Accutane and a bunch of different medications, and it's totally cured, right? She was saying, I can't believe that I would go from 30 years of unrelenting cystic acne to now people complimenting me on my skin. She's like,
that's cool.
Yeah, it's totally cool. It gives me goosebumps, because you just imagine the life change.
Well, aren't you like 300 years old?
Exactly.
Yeah, I guess I would assume you've done this on yourself.
Oh my gosh, big time.
How has it helped you?
Well, I'll tell you, 2 years ago, when I started doing this in a significant way, for instance, exercise. And I'm an active guy, was a college athlete, have been athletic and try to stay athletic and eat healthy and all that good stuff. 2 years ago, my HSCRP, which is the most discriminating measure of total body inflammation, it's also a great measure, prognostic measure of potential for heart disease, potential for basically organ failure. When that is high, when your CRP is high, that's bad news. 2 years ago, my HSCRP was 2.3. That's kind of mid-range low for a 48-year-old. I'm 50 now, about to be 51. That's mid-range. 2.3 is about mid-range. I was doing once every 2 months IV, and about halfway through that year, I started doing daily sublingual. Doing that regimen, in 1 year, it went from 2.3 to 1.2. That was a low CRP, 1. Wow. That next year, which was last year, that was last December, not December 25, December 24. January of 25, I started doing monthly IVs, daily sublingual every day. And then in the last 3 months, I did daily LNAD plus. That's our lactomized NAD. That's the intercellular NAD. December of 25, my HSCRP at 50 years old was 0.1. 0.1 is the total.
It's unattainable.
It's like of a 7-year-old. It's like, it's wild. That's no other lifestyle change. That's the exact same level of stress and, running a business, all the things that you have as a 50-year-old founder, and you can't get a lower total body inflammation. And so that's one incredible measure. There was the article in the Wall Street Journal titled "Inflammaging," right? This conflation of inflammation and aging. And, this was maybe 3 months ago in their weekend edition. They talked about how science is essentially getting to understand that the condition that we call aging is essentially inflammation. The inflammation is not something from aging. Inflammation causes what we call aging. And so when you can reproducibly take inflammation completely away, you not only increase the regenerative capacity, you decrease the degeneration. And so it's not just one, not just raising one, your gross regenerative capacity, it's lowering the other significantly as well at the same time. And so when you do that, I've got our social media, on every social media is at Apex Regenerative, all one word. And on my social media, I've got a side by side of my face, unfiltered, my face before I started doing that, and then my face, and it's, now it's maybe 6 or 8 months old. And it's crazy. I have done no other aesthetic anything. I can't stress enough. I'm doing, Axe 5-in-1 body wash on the same loofah I wash my body with, right? That's my facial regimen. Typical ambassador sort of thing. And it looks like I have aged in reverse. That was not my intent, right? My intent was performance and longevity. But the reality is it's a external representation of internal regeneration. This is what it looks like. Your skin is the fastest turnover cells. Your skin cells are the fast turnover. So as you're arming them with more regenerative potential, more regenerative capacity, and they turn over fastest, well, this is what happens. You can see a marked change in, my skin condition and health. It's really wild. The folds of my eyelids and kind of all the wrinkles around my face. And this is, it is what happens when you increase your regenerative capacity.
It'd be a pretty stupid joke, but I was thinking, what if you were accused of spreading misinflammation?
Yes.
And that makes no sense.
That is a stupid joke, but it's right up my alley. So
yeah. Well, right on, Caleb. So what, if people are located in Austin, great for them. Are you able to do this nationwide? Are there registered clinics, or, how can people find out more and get this help?
Yeah. So our website is theapexmedical.com. And then, as I mentioned, are on all socials. So Instagram, Facebook, and TikTok, we're at Apex Regenerative. So reach out to all those, to any of those. And then we can work with providers. We do kind of our main hotspots are Southern California, in the Texas market, South Florida, but we work all over the nation. And so if you don't have a provider who does this currently, we can work with your provider. Or, as I mentioned, a lot of people come in and will kick off their protocol with, say, a long weekend in Austin. You're in Austin, it's a fun town to visit. Doing that over like a Thursday to Monday, time period, you can get in a couple of potential injections and IVs and then be on your way with the at-home protocol as well. That's a good start that many people do. People come from outside the U.S. to do that often. We do that every week, have people come from Europe and South America. And so, those are two ways. In Los Angeles and Orange County, we can come direct to you with IVs at your home or office. And then in any Texas metro area, we can do the same thing.
Okay. Excellent. Well, Caleb, thanks for coming on. I really appreciate it. And that's fantastic that, these things, I've been studying them for a few years and glad they have such widespread positive uses. So, I encourage listeners to have any problem to check it out. And again, thanks for coming.
Awesome. Thanks so much, Richard. Appreciate you.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.